Well, I was working at the VNA at that time when I first became aware of the enormous need to work with children as young as possible. At the VNA, we had begun to be aware that prevention and early intervention was the essential piece that was primarily missing from our approach. Because of people like Dr. Spock and Margaret Mahler and eventually a host of other people were telling us about the things that we had better change in bringing up our young children, and that the first few years of life are the most important of all. Well, the first child protection team that I'm aware of began at Mary Fletcher Hospital, and it began with Teresa Tomasi as director of social service there. I'm not certain whether it was she who convened the team, but I'm sure she was instrumental in doing it, and to that came psychiatrists, pediatricians, and the 4 or 5 agencies that were most intimately involved. VNA, Maternal Child Health, was one of them. And we met once a week at the hospital. We deliberated always about cases that the SRS, Social Rehabilitative Services, brought to us. And we increasingly became aware that medical wasn't enough. The social issues were overwhelming. And one day, sitting at the team, somebody very smartly brought in the Federal Register, in which there was listed a national grant, a federal grant, that could be obtained to do work with child abuse and neglect. Teresa Tomasi, Marge Wood, who was a new clinical person in town representing Howard Mental Health, Marion Paris from SRS, I from Maternal Child Health. Roman Kokadiniak came from Spectrum. And Roman and Betsy Davis, the director of VNA, and I think were the chief writers of the grant, although everybody pitched in some. And if anybody's written a federal grant, they know what an agony that is. But we got it. And then began the task of how to use it well. The money was divvied up amongst the 5 initial agencies, and the child protection team was moved out of the hospital and moved to agencies in the community. I think we were on some kind of rotating schedule at first, so that everybody felt part of it. And other agencies brought cases, and it was the beginning of the growth of the network. One of the many wonderful things about Vermont, and Chittenden County in particular, is that we have been able to attract a marvelous host of talented, educated, caring people. We have a great deal of talent right here, sitting in this room, and we have used it well most of the time. I want to encourage everybody to keep on trying, because we can do it in the end. Life can be better. Chittenden County and the state of Vermont can lead the nation.